Good afternoon and welcome to Genomics Gupshup. Genomics Gupshup is an initiative by Mapmygenome to create a community around genomics and to simplify genomics for everyone. And we do this by bringing together experts from allied areas like medicine, genetic counseling, nutrition, fitness, and more. Please join us as we spread the word about this exciting science of genomics. We are now available on your favorite podcast as well. Just search for Genomics Gupshup on Apple Podcast, Spotify, Amazon, or Google Podcast. Today, in our 30th episode, we are thrilled to welcome Dr. Rajesh Khanna, who's a senior pediatrician. And a lot of times, I think it is very hard to get his time to be there. I think we saw that many phone calls that came in while we were just trying to get this started. So thank you so much for your time, Dr. Rajesh Khanna, and welcome to Genomics Gupshup.
Thank you. Thank you for giving me this opportunity. So, nice initiative. I appreciate that. So, we are always very much happy and delighted to definitely participate in such shows so that such kind of awareness programs are very much needed so that patient education is the backbone of our practice. If the better they are educated, and half our practice is built on the patient education itself. If patients are ignorant, illiterate, the kind of the presentation which they bring in will be on the complicated side. So I welcome your approach and thank you for giving me this opportunity.
Thank you, Dr. Khanna. So I think I was very curious about your name. Just wanted to check, were your parents fans of Rajesh Khanna, the movie star, or is there something else to the name?
I am basically from Hyderabad only, South India. My parents were Lord Shiva's devotees actually. So we have a devotee, right? Bhakta Kannappa. So that Kanna stands with KNN actually. So my name was initiated as named as KNN only, but in certificate it has mentioned KH. So I let it go like that. So that's how I became as a KHANN. Rajesh Khanna is a North Indian.
Correct. Not just North Indian, but a very popular movie star. So I guess, when you first type in Rajesh Khanna, you'll get both pediatrician Rajesh Khanna and the movie star Rajesh Khanna. But it's an interesting thing because in genetics also when there is one change of a letter, I think it can make a big difference. So I guess from Khanna it became KHA.
Nice comparison. Good. Yes.
So Dr. Khanna, why did you become a pediatrician? I mean, of course, I can see you have a very busy practice, but what inspired you to become a pediatrician?
Yeah, see, becoming a doctor is from my childhood's dream because every generation of my family is a doctor compulsory. My forefathers, grandfathers, everyone. So one among that generation should be a doctor. That's a dictum kind of thing going on. So my father, in this present generation, he from my childhood he tuned my mind like that. And at the same time, both the parents were doctors. So that inspired me a lot. And my father trained me in the medical side when I was in my childhood itself. Like before I joined medical school, my father almost taught all the medical subjects. So I was ahead in medical education, and I was with my parents during their clinical practice. So that the way they were interacting with the patients and all that inspired me a lot. And coming to the pediatric subject, so after my finishing MBBS from Usmania Medical College, I had an option of pediatrics and MD pediatrics during those days is considered as the highest form. So those in the high top merit list, MD pediatrics subject getting itself is like a kind of boon for us. So I have chosen this path, after which once I was practicing with kids, I loved the subject a lot because treating kids is something special. Becoming a pediatrician, you are a wholesome doctor because you can treat on both age groups. Even adult side, you can treat like a physician for the parents also. But when you become physician, it is very difficult to become a pediatrician. You cannot practice pediatrics when you are just a physician alone. So that inspired me a lot. So I thought like better be on the pediatric side and treat both the populations because coming with their kids, many grandparents and their children and their parents also. they seek medical advice, and I am in a position to treat them as well. That gives me immense medical satisfaction. So I am blessed to be a pediatrician.
I think it's great that you're not only treating the children but also the parents and
Yes.
grandparents. Because
Yes.
I remember the first time I had a baby. I remember there's a lot of anxiety about, no one knows how to manage that very well. So I'm sure you get a lot of questions around that, as you know,
Yes. Correct.
what should I do? My child had this
Yes.
and
Yes.
something like that.
Correct.
Uh, so is that something that you get a lot of, or what kind of patients do you normally see? Is it a lot of it being first time parents,
They,
or is it
yeah,
other
yeah.
kinds?
So in Hyderabad, I practice in the most like premium segment areas, Jubilee Hills, Banjar Hills area. Here, most of the time we face the highly educated population, parents only. So there, the parents are almost having 50% of the medical patient education material with them as well. So they Google, they read about it. So when you face a parent with kind of some subject information, you should definitely be ahead of them, and you should be up to date in the knowledge. And it's quality practice that you are teaching the parents, you are involving them in the care of the child. It's in fact, the job is made simplified when parents are well educated. At the same time, it is challenging for the pediatrician that his knowledge should be up to date, and he should cross that edge. You cannot be like in the peripheries. There is no time to spend time on educating the parents. It's basically you just mention the treatment, and half our time is is spent just only on treating. And the volumes are more in the peripheries. Here we have scheduled appointments for every patient. We take at least 5 to 10 minutes to check their growth, development, vaccinations, nutrition, and all the basic important information, and complete wholesome approach is there. So that gives professional satisfaction to us. So that's how we are approaching, and it's good that we are getting time to spend in academics also.
So you do
So
a
we
lot of
have regular
research.
academics. I am associate professor of pediatrics, due for my professorship. So this kind of academic activities blended with my practice makes me more wise in my practice.
That's great. I think we definitely need a lot more people who can understand both the medical science as well as the research aspects of it and the teaching, because ultimately I think medicine is a field that is growing so rapidly that
Yeah.
if we don't have these crossovers, I think it becomes harder and harder to
Yes,
keep
that
up.
is my appeal to majority of the doctors who attend my classes, sessions, which are held almost on a regular weekly basis. So I teach medical graduates. We have up-to-date meetings with all the other pediatricians, my colleague pediatricians as well. So wherein I appeal them ki at least spend some time, at least 1 hour, at least a week, to spend on the latest updates, and at least 2 minutes of their time in educating the parent regarding some nutritional advice or some vaccination advice brings a lot of difference on the preventive strategy.
Mm.
So the child might be coming to you on a regular basis with recurrent symptoms, but if you spare a minute or 2 minutes, then what happens? You are helping the community in reducing the disease burden. So our aim and target goal approach is not only just building our practice, but also to make the society healthy. So that approach towards social approach that should be there in our minds to make a healthy population.
No, I think that's very noble and great. And I think one of the things that at Mapmygenome we are also propagating is that prevention is
Better than
ultimately the cure. And
yes,
I
yes,
saw a lot of your videos on nutrition and urging parents to sort of
correct.
reduce on the junk food. And I know it's not an easy thing because of you stop go into any supermarket and you'll see so
True.
much appealing, so
Right.
many appealing foods for them.
Yes.
So, you
The
know,
first step to changing our mindset, or the initiation towards transformation, or you have a problem and you want to get rid of it itself is the first primary step is educate ourselves. So that education should be brought by our informative materials, some videos like this. Today's days of digital marketing. So you have a lot of access through digital media. So you can educate parents. And that first step, if they put into practice, when they get educated and put it into practice, initially they may face some challenges to overcome that. Because preaching is easy, but putting it into practice is little difficult. But when you are strongly determined, that difficulty is erased over a period of time. When you are not determined and you are halfway through that and you just accept the way it is going, you will never get rid of it. So basically, our mindset to strongly determine and follow doctor's advice and adhere to doctor's advice, that is more important. Adherence is very, very important.
I think it is, when you become a parent, I think,
Yes.
I don't know if there is a thing called a good parent or how people learn to become good parents, or do you think everybody learns on the job?
Because see, I myself a father of twins, so I face a lot of challenges when I teach also. So based on the problems which I face personally, so putting a word or taking some advice and just putting into practice definitely is a challenging thing. But my own principles, which I teach the patients, the parents, that when I put into my own practice parenting, I have got the result. Why not others? Everybody will get the result, but that perseverance is important. Yes, agreed that children always are like, that's why they're named their children. That is a unique character of them, that they will throw some tantrums, they behave fussy, and that parenthood nowadays is like a busy lifestyle of parents, right? So you have to compulsory overcome that. You're compulsory at least spare some time in listening to doctor and following his advice.
And I think, just like you mentioned that, you were in a family of doctors. So in some ways, maybe medicine was in your DNA and you also saw that as a nurture thing. And I guess similarly, I think people learn about how we eat from looking at the parents as well, right? Like I think a lot of it is imbibed from just looking around you,
Yes.
both peers as well as what you do in the family. So I think, maybe if we all become better at eating ourselves, then maybe we will inspire children to do the same as well.
Correct. True.
So, doctor, when did you start? I know that you do a lot of you are very aware of genetic testing and you are doing that quite a bit. But when was the first time that you found genetic testing to be helpful for your patients?
Yeah. See, pediatrics subject itself, when you choose, you have definitely a separate segment of population dealing with genetic disorders. I think no other branch will have to face that, because we are the first professionals to handle these disorders. And majority of the times, it's pediatricians' advice sought for the genetic disorders. So right from the time of birth, that at which we have to rule out the anomalies, the genetic disorders. So newborn screening has come into practice at least seriously from 2006 and 7 onwards. Thereafter, like some parents were not that accepting. From 2016, 17, after a decade from when it actually entered us, it took so many years for us to implement actually in a large scale. Because initially the acceptance rate was less, the cost was high. Now, when it is going widely, the cost is being reduced significantly. Now, every parent relies on the pediatrician advice. When pediatrician himself is not like he's not what I say, he's not convinced about the need of the newborn screening or genetic screening, he cannot convince the parents. And how will the pediatrician get convinced? Is looking at the data of the rising incidence. Like when you screen more, you detect more. Right? When the incidence, see, for example, 1 in 3,000, 1 in 5,000 figures has come only after rapid screenings. Initially, initially it was looking at as 1 in 3 lakh, for example, any disease. So when you if you detect the disease at an early stage, you will start treatment at an early stage, the prognosis will be better, outcomes will be better. So this is how pediatricians should take into the mindset of parents. So I appeal, yes, to conduct some meetings with doctors, professionals who are really working hard in the peripheries, where see clearing the volumes of patients itself is a tough job for them. For them, once in 3 months or once in a month, if you conduct some meetings where doctors can give some updates for them, then what happens, if we are sharing the knowledge with them, data with them, they will create awareness in the public. Let this knowledge reach the masses. Then what happens, people will start respecting the doctor's advice. Even doctor himself tells that as an optional thing. Even now I see some doctors prescribing it as an optional thing. So that mindset we have to change. So 2016-17 onwards, we were doing vigorously, and our practice, we don't miss even a newborn without newborn screening, that genetic disorders, at least if not all, at least 7 to 10 disorders, the most important disorders, we are screening every child, every child.
No, I think that's much needed. I think many countries have made that as a standard of care.
Correct. So if it is coming from the government's policy as an initiative of, so when it is done from the government point of view also, then what happens, the acceptance rates will be very high. Not everyone will be affordable, right? But those who are affordable also, they are still under the impression that it is an optional thing.
And also I think we saw that, like, if we can make, because if you just want to do base level newborn screening, I think we can look at some of the conditions that are there. And I think now the costs are not as high as it used to be, because later on, I think the cost becomes higher, right? Like if you leave it untreated, I think that cost is way higher.
Always see, I face many such questions also. One of the question is like, for example, you get a meningitis. The parent asks that the cost of the treatment for meningitis is much lesser than the vaccine cost. Such questions also comes. Then I say, whatever it is, prevention is definitely better than cure. And for the cause, you want to face the disease, you want to land in the disease and test whether your treatment is working. Sometimes, what if your treatment doesn't work? If the bug gets resistant for the drug, then what happens? You will land in complications and death is inevitable in such cases. So you cannot take any chance. Vaccines are very, very important as a measure for prevention, as well as any disease, for example, diabetes, hypertension, or even genetic disorders. If they are screened at an early age, you will definitely prevent the disease progression. You will halt the progression. You will keep it under control before your organs are damaged.
I think most of the time, one of the things, and I think you mentioned this as well, that people are saying that sometimes the treatment is cheaper, but it's not only about cheaper, it is also about the damage that it can cause you, right? There's adverse effects that might be there in some cases. There might be, like you said, resistance to any treatment options as well.
Yes.
But I think, I know that even among the educated population, there are people who strongly are opposed to a vaccine, right? I mean, not a very large number, but there is a
yeah, because see, what happens is, see, every aspect of medical treatment carries some risks with it. So when one out of some 10 to 15 lakh patients who received, if one gets some adverse effect, immediately the next day media publishes it as if that 1% itself is a big threat to the society. Then what happens? The rest of the people will start rejecting that. So you need to see, you can publish or project what happened to that 1%. At the same time, publish the benefits of it also. So when benefits are outweighing the risks, always we should come forward to take adapt to or accept that modality of treatment. So if the risks are outweighing the benefits, yes, so if the risk is very high, then benefits are less, you will reject the treatment. So we should not discourage those who are approaching the medical modality of treatment. See, you when you're publishing such data, adverse events reports also, you in the other side of the column, you mentioned experts' advice and benefits related that the which how many landed in it. And the educated population, when this set of data is projected, definitely they that because of lack of proper education. Lack of proper education, this is happening.
Yeah, I mean, I like to tell this as like, there are road accidents that happen on, but that doesn't stop us from going in a car or going somewhere. I think it's the same way. I think you have to look at, when you look at it from an overall perspective, I think it doesn't, you have to see whether that is going to help you in some way. And, and I think now we are coming up with newer technologies to be able to help us identify who are those people who maybe will not, for whom it will not work.
Correct. It's like the technology is advancing. Initially, you may face more risk, but as technology is advancing, you are heading towards better development of medical products, vaccines, other which have least side effects. And when doctors approach the parents are coming, that minimal amount of side effects which are faced, it's okay you mention to them, but should not discourage them or prevent them from getting vaccinated or not. Similarly, the test approach also, investigation modality also, when it is really needed, see, it all depends the way we are counseling. Our volume, our tone, voice should be filled with confidence, and that confidence is filled in our throat only when we are becoming wise and getting proper education. So this evidence-based medicine practice, when you're looking at the evidence, data, and you're learning, listening to the experts in the field, you will get that confidence. When you are in the dark and don't know what's going on, your voice is muffled and you cannot strongly convey the message. You yourself are not convinced. How will you be able to convince? And for example, our genetics thing also, see, day by day the screen time is also increasing. Parenting approach is also being changed. What's happening is it's all nuclear families now. Joint families are not there. Both parents are working. Parents busy with their mobiles, with their laptops. Children are left over to watch screens, and their behavior is getting very much abnormal, and they're landing in autism spectrum of diseases. And screening such diseases or like development assessments, genetic background of this disease, and all later on when they come to us, when you are ordering such tests, which is little expensive also, there that hesitancy is coming. And acceptance of the abnormality itself is a tough thing for them. It comes as a big blow to them, that they will not be ready to accept that their child is abnormal. And similarly, any genetic disorder which you are facing, like you are able to look that dysmorphic faces, dysmorphism, what we call abnormal features. It sometimes may be a mere different normal, a variant of the normalcy itself. We cannot totally declare it as being abnormal, and we cannot change their parenthood also. We cannot discourage them from it. It should not always project to them or make them less interested in their parenting. We should be giving a positive ray of hope and trying to seek their faith and convincing them properly to get the test done. And once the reports are come, which will adhere to your diagnosis, then you project it properly, that proper counseling is required, and then you will how approach to a child. So these are limitations for the genetic disorders approach from the pediatrician or any clinician's approach.
I totally agree. And I think, one thing that maybe what we have seen is that a lot of times, if the education is there, parents are going forward with it. I remember a long time back, One of my friends actually did not realize that we also do these kind of tests. And he said that, my doctor did not educate me about this. And then I read later on that, we could have done tests like that. So I think one is clearly, I think from our side, we need to, raise the awareness levels. And I think if we can.
Sometimes see medical profession practicing is also not that easy, because see we are having, suppose if I have 10 patients today, I have some time to spend with the patients. I'll go into the depths and I'll share all the informations. I'll touch every aspect of what is required. But then same day I have to see some volumes, 30 to 50 patients.
Wow.
Then what happens? I'll may not be able to spend so much time in counseling. Then I alternate methods I'll have to find out, like placing some handouts or some display pics, where in the waiting area itself, patients are half educated from there. So they'll take the leaflets, they'll go through that. You just share your website details, wherein you will save the information. That's how you'll spread the awareness. So you will share your videos and ask them to, what is really required in this consultation. You'll address that. At the same time, you'll ask them to go through further details through the links provided. That's how you should approach.
I agree. And I think we'll make sure that we can also do our part in terms of the education. So you mentioned a little bit about autism, and do you see a lot of that happening? Because I remember once I was talking to another doctor, and she mentioned that the number of cases that they're seeing have increased quite dramatically. So
Yes.
is that your?
These days, as I said, these days we are facing like every week, I can say every week 1 or 2 such kids are coming to my practice, and those kids, among them also, like it's the parents' hesitancy, because they have to spend some time in taking the child for development assessment, behavioral modification therapies, and all that. So before that, first thing we should educate that at least stop screen time or reduce screen. And second thing is spend some quality time with their kids. Third is avoiding all junk and packed foods, outside foods, which have also got influence on them. So these 3 things, if they follow, like at least you are contributing to some part of the treatment. Then if the child is not improving successively, you will slowly advise them to get the test done, so that the reports which come will change their mindset. If the reports are also suggestive or support your diagnosis, parents are 100% convinced. And your findings, they may not sometimes just value. So we will have to take the one step ahead towards genetic component of it also. So they will always try to deny what you are telling, that you reduce, they'll say hardly watches half an hour or 1 hour. Sometimes they bluff that he doesn't watch screen also. They'll not accept the mistake in front of the other parents, right? So that's when you will also attribute some other factors. Nutrition wise, yes, you will just advise. You don't know when, how they're, but genetic wise, you cannot bluff them, right? You are, if that part is also ruled out, if they have some background of genetic copy number variants, that thing. So what happens is they are now convinced 100%. So they have to start some medical management. So such things now, they have to read some leaflet, go through our education materials, and also see what happens. This area of this area segment of management medical practice is having a kind of dismal prognosis. What happens is sometimes you'll not get the desired results, because it's an integrated holistic approach is required. Mere telling or teaching parents also sometimes doesn't reflect in the improvement of the child. They have to put into practice. If they don't spend some time, and what you have said to them is not implemented, put into practice, you will never get the results. And they keep changing the therapy centers, development centers also. They'll keep on shopping different centers, different doctors. Ultimately, child's treatment is delayed. I get parents from abroad also. They're not satisfied with the management. They come here, and I advise something here. They have to adhere to the treatment here. So this kind of movement happens because of lack of proper counseling. So day one, you have to tell that without your involvement in the treatment or without your approach, we cannot be successful. So it's required that now people like you have genetic counselors and like you have some kind of education materials, audios, videos, modalities. This brings a lot of change actually. Now the things are getting changed now. So I can see parent awareness programs are increasing, so their approach is also modified.
So I think you mentioned one thing which I know is a difficult thing, the one where you're looking at changing their nutrition. But I think once they're aware, I think they are determined to actually change that, right? Now, one of the things that I'm thinking about is that when you look at the microbiome, it was just a test that we've just recently just launching. Is that you might tell that you have eaten healthy food, but you can see in your microbiome what you've actually eaten, right? So maybe, do you think something like that would be a helpful thing from helping parents understand?
From past 1 year, I can say dysbiosis is my favorite topic, and many videos of mine is addressed based on dysbiosis itself. So ubiome, retaining the ubiome is very, very important. A healthy gut itself plays crucial role for treating majority of the disorders. If gut is unhealthy, you will land in many diseases. So gut rules your body actually, your brain functioning, your nervous system functioning, every immune system functioning. So everything is dependent on healthy gut, and your gut health is depends on what you eat. So you need to take care of your gut health, and you have to preserve the ubiome. Eubiosis, if it is disturbed, causing dysbiosis, always leads to diseases, including obesity, diabetes, hypertension. Now, see, vitamin D, past 7, 8 years back, it has become a novel drug for this decade, right? Every specialty's prescription includes vitamin D. You go to endocrinologist, cardiologist, neurologist, everyone's prescription ends with vitamin D, compulsory. Similarly, now this dysbiosis as a part of the diagnosis or as an attributing factor comes to every specialty. Neurologist also has to attribute to a dysbiosis. Your endocrinologist also will attribute to dysbiosis. So every field of our medical practice should address dysbiosis compulsory. That and your approach for this, yes, it's a welcome approach, and such things also will change the mindset of the parents. It's good approach from your side as well. We will support such things. Definitely good initiative.
So I remember when we were doing, so the last 1 year, 1.5 years, we've been doing a lot of research on this. And I remember when I'm relatively a very healthy eater. So you could see that when I did the first time, it was fine. Everything looked great. Then during Diwali, I was obviously got tempted by a lot of junk, and sweets and other things. And when I did my test that time, you could see a change in the microbiome. You could see that was there. So I said, I might be saying I'm eating healthy, but it was very clear.
Yeah, so this initiative from your side also should reach the large scale of population, because such thing is really being there, existing in the market to do so, coming from the doctor's advice perspective, and touching the importance of it. So widespread education, doctors advising the parents, everything is involved, compulsory involved. I think pediatricians are the beginners for your success actually, because it's from our end, actually it begins your story.
Totally.
So it's first specialty which can contribute to this will be pediatrics.
I agree. And one more thing we find is that, we keep telling that we should be doing carrier screening, right? When parents are planning a baby. What we have found is that normally we are seeing that it is usually for the second baby that parents are coming for that.
Yeah.
I think maybe that education is
That
coming
also
from
begins
pediatrics.
from our end only. Antenatal counseling. Now, obstetricians, like we are creating awareness with obstetricians as well So every antenatal woman who is coming to them, they will attach pediatrician consultation also. I openly offer free consultations to all such antenatal women. So antenatal counselings are like our first step of our practice of for an individual. So such babies healthy development inside the uterus, so that brain development or immune system development is beginning from the embryo level itself, right? So whether the baby is healthy growing or not, or what contribution from your end is needed for the healthy development of the fetus, that real time education is driven by the pediatrics actually. So from the fetal stage onwards, development. So obstetrics oriented approach is different, pediatrics approach is different. When both together approach a patient, they will get better benefit. So we will actually have to create this awareness that have you visited your pediatrician. Second thing is, first child having any genetic disorders anomaly, and they don't want second child to land in such anomalies, they go ample screenings, and how to prevent such anomaly for the further pregnancies, future pregnancies. Before even genetic counselors are met, pediatricians are counseling is very much, and their advice is sought. So then resort for testing both the parents. See, we have lot of ethical issues also. Some religious beliefs are there, and see, always the mindset of our community is like most of the time all the investigations are traced out only on the females. Males are little like, see, when you yourself create some sort of disturbances in their marital life also, based on this, that the culprit is this fellow, not you. That culprit gene is residing in that, that should never happen actually. So the way we are counseling should be something, should be a collective approach. Both the parents should be involved in the success. So you should give them some remedial measures. We should give them a ray of hope also, how best they can get rid of it. So if definitely premarital screenings, if that stage itself, even if some disparities are arising, if you are cutting down at that stage is okay. But once married and later you are finding some abnormalities, you should not highlight such issues. Should give some remedies, that's it. But premarital things, it's hardly anything going on. But at least with our approach and counselings, education programs, yes, people are now willing to take such premarital, in which such the major disorder screening should be placed in that profile, health profiles checking, wherein, for example, thalassemia is so common nowadays. One addition of HB electrophoresis itself, when you are preventing 2 minus, now creating a major child, thalassemia major in the child, that itself is a mistake from our end, right? Just undergo screenings found, then it's the choice is on the both the sides, boy and girl side. But as a responsible doctors, if the advice is sought that how carrier screening is going on, then it's definitely important from the genetic screening that you will give them this profile with such screenings. Then you will prevent. So our prevention step starts from there itself, right? You are preventing the fetus, abnormal fetus.
I agree. I think we have created Match My Genome to be able to do that, but I think the awareness levels are still not at the levels we would like it to be. But do you see a lot of consanguineous parents that come to you, or because I know that in this, especially in the South, I think a lot of times there are marriages that happen.
See, our family system is so built that joint families which were existing, people definitely feel safe that our girl baby, when married to our nearest relative, is put in the safe hands. But coming to the genetics, when close genes are united, then resulting in abnormal outcomes, so can happen, that risk is there. So from our medical school onwards, when you are taking a history from the patient, the genetic history, whether consanguineous or non-consanguineous, consanguineous or not, putting much emphasis on consanguinity alone. As I said now, before marriage, you are highlighting it. It's well and good. Definitely, you highlight and you put it in a danger situation. You simply deny also. That's okay. But after getting married, you just attribute everything to consanguinity, then quarrels begin.
True.
So you cannot attribute everything to consanguinity itself. So, as at a personal level, myself itself, I just take that history, but you should not always put the parents, project them as a culprits, and then they start quarreling among each other. Why this happened to me, and they will also go into depression. So, happened is happened. Now, marriage is done. uh, Show them the remedial measures.
True. I think
But premarital screenings, yes, you highlight that. Better you avoid consanguineous marriages. But after getting married, no, don't have create that repentance also.
correct. I mean, I think after once that is done, I think what you can do is provide counseling and support to the parents.
Because there are many consanguineous marriages also, parents, but outcomes are good. No genetic abnormality seen. So may or may not happen. We should create awareness.
So, I mean, one of the things we started preventive genomics about a decade ago. But we found that, there'll be some people who said, okay, I don't want to understand risk for certain kinds of diseases, especially things that come later on in life. But, we've been talking a lot about nutrition. And one of the things that we are doing now is we're saying that for children especially, can we create something that makes them more aware about things like nutrition, things like what their potential is in terms of sports and other things, so that they actually adopt a healthier lifestyle. And when you do adopt a healthier lifestyle, the chances of you getting other diseases are also reduced. When you reduce obesity, you're reducing a lot of other things as well, right? So do you
Yes.
think that approach is a good approach? Because we've now come up with a product for beauty and for children, because we
Yes.
don't want people to be intimidated, but we want people to be able to say that if I take this information, I can actually get people to be aware and therefore make certain changes.
Now, for most of the diseases now, uh, uh, we are going into the genetic level to understand the genetics. When you understand genetics proper way, your medical research is advanced and the treatment is simplified and preventive strategies are built on it. Now, majority of research, for example, obesity, diabetes, and all, the attributing factors, genes related to it, are from the infant or from the fetus level onwards. Now, some lifestyle diseases whose the disease component originated from the childhood. So the child, in fact, is heading towards that. If the modification doesn't happen at this juncture, this child will land into such disease. That kind of projective approach, like you project the parabola, see, you are growing in a certain percentile of weight. For example, you are growing in a 90th centile. You on height on a percentile. You project this to a certain extent that at 10 years age, if you are growing the same centile, you will reach this. That target height and weight is predicted. Similarly, if the current child's nutritional status is projected, you will tell that this will lead into such things. That's how your approach should come. So this projection phenomenon begins from the pediatrician itself, and you are attributing every disease to the childhood level. So it's the preventive strategies also should begin from the period. That's why I told you your first approach starts from the pediatrics.
I agree, because I think what you do and when you are a child, I think is what
Any child presents with me just before our session, a 10 years child coming with a 54 kg, we take the BMI, we'll show them on the chart that this child is falling on the overweight side, can land into other non-communicable disease, that is diabetes, hypertension. How best you can prevent? What is that? You offer them the input and output. You just put some time and give them some diet chart, calorie calculation, and you tell at the same time how best they can put on the expenditure. How can they spend their energy? because these days are sedentary still, sitting and reading or sitting and watching television, screen time is increasing. They are less participating in the games and activities. Outdoor game activities has reduced a lot. Now in some gated communities, something can happen, but majority of the sites, you don't have ample place for them to play. So how best all is indoor activity there. So how can they improve themselves? How best they can spend their energy? That's how we should discuss. Our approach should go on.
No, I agree. So I think, I know that we've reached about an hour and I don't want to take up too much of your time, but there are two more segments of this talk. And I think with you, maybe I can talk for a few hours on many different things. But I want to just ask a few questions that I normally ask everyone. One is, and this especially for you, I think, because what is prevention in your view? What would be the first few things that you could advise parents and children?
Yes. See, anything which is spoiling your current health, a simple strategy which can reverse back what is going wrong in your body. That strategy is a preventive strategy. So you are not landing in a disease. At the same time, your organs are not getting damaged on a daily basis. So how best is first thing is comes from the nutritional point of view. Modification, your daily lifestyle modifications. That is the first preventive strategy. Lifestyle modifications, which includes some nutritional advice, some exercise, some daily how best they can live their life on a simple daily basis. Second strategy is screening of the diseases. You don't have that particular disease now, but you just screen for it. For example, you screen a child for sugar levels, thyroid levels, vitamin D levels. So on an yearly basis, you check their urine. If the child's protein loss in the urine is happening over a period of time, it you land some, because the first presentation of diabetes in children itself is diabetic ketoacidosis. They are landing in ICUs. That's when you check their sugars is on the higher side. Till then, no one will advise a child to go on a periodic sugar level checks, right? Because they parents think that it's on for the older age side itself. No, that should not be like that. So as I said, first is lifestyle modifications, behavioral modifications, including nutrition things. Second is screening, health screening with some investigation level of this falls into a preventive strategy. These are the main pillars for the preventive strategies.
And I think if they could also understand if there is a genetic basis to some of that, I think we find that people often
so in that health screening strategies itself, you are including some things. For a newborn, you are including the newborn screening genetic test, and for the other children who are abnormal, you are adding some genetic tests, and for the history who are having of recurrent pregnancy losses or first child having some abnormalities, some carriers or some genes or genetic abnormal, as a preventive strategies for further future deliveries, future pregnancies, you're offering some tests. All that also for so basically screening a disease or trying to look forward for what's going on wrong with you is a preventive strategy.
And what is healthy aging? I know you're a pediatric doctor, but still, I'll ask you, what is healthy aging in your view?
Yeah, see, cosmetic and appearance wise itself, the aging thing which you can see, but free radicals generation, unhealthy food habits, too much of stress, all adds overthinking, all adds. For the children, too much of screen time, their unhealthy food habits, less amount of exercise, play, activities. This all leads to early aging. So healthy aging is one, you are preserving your health. Age anyway will progress. You will one day become old, but you are healthy at current age. You are healthy as per your age. You are healthy. That's an healthy aging. You are maintaining your health. So good lifestyle, healthy eating practices, periodic annual health checkups, periodic doctor visits, all will help you in healthy aging.
You think that if we come up with like, when you look at epigenetics and look at some of these markers that are there, we can come up with there are a lot of these biological clocks that are, biological clock versus your current, where you are today, right? Your real age versus your biological age. And do you think that's something that gets people to be a little bit careful? Because, if it says that you're currently 50 years old, but your age is showing 60, then you are aging way faster than
This
adults.
kind of approach needs a little time spending with them, counseling them properly. Maybe like I have now busy OPD practice. I have one more guy, people like you sitting beside my cabin, spending some time with us. So it's like mutual approach. So when it begins from us, just you transfer some patients there, you are screening, you are creating awareness. From there, the word of mouth spreads in a large way. So begin with some patients, it is projected into a large scale. So your early step in early initiation itself will bring lot of changes. So creating all such awareness is very much needed. So together we should work actually.
I agree totally. So I know that you probably hear a lot of myths. Any specific ones that you would like to debunk today in terms of what you hear from your patient?
Not all genetic disorders are dangerous. They are treatable. Screen them well in hand so that you will find solutions. They are treatable, very much treatable, and sometimes reversible also. And you have many solutions for it. No need to get disheartened. And we are made of genetics. Our body is made of genes. So you are part of it actually. You cannot see if you're don't you cannot escape from it. Know what's going on wrong with it very soon. For every most of our health screening package will include this genetic testing as well, because genetic testing is not just oriented towards the qualitative and quantitative disorders, but we are going to research genetic level, wherein identifying the genetic disorder, genetic error which is causing such diseases. When we are picking at that age, maybe we have solutions to modify such things also. So people should always believe what doctor is telling and adhere to its advice. And false beliefs of identification of some disorder is irreversible. Why to identify and just take some risk or take some stress is a false belief. Identification itself will give you the solution.
I think when you are more likely to act upon it. When you measure, you're likely to act upon certain things. We'll move to the last round of this talk. I don't know if your screen is frozen a little bit.
Yeah, how much more time we have?
Yeah, just 5 minutes. I know you have patience. So,
Yes.
So this is a very quick round. What is the most common complaint about you by your friends?
That I am busy, I am not that approachable, and I don't visit the parties, functions, and my phone calls sometimes are unanswered. That is the most common complaints. Approachability is difficult.
I guess when you're busy, you can't help it. If you were not a pediatrician,
Yes.
what would you have been?
Scientist.
Scientist. I guess you already are in some ways. You're a morning person or a night person?
That's more on the physics side. I love physics.
Okay,
So,
nice.
so something more on the research oriented side. This is more on the clinic side. So dealing directly with the disease component. If not on this part, I would definitely on that research, sitting in the lab, finding out the cause for it. For time, I will not have definitely time to go into that level, but I have a lot of curiosity to go into the depths of the disease and finding the etiology properly and new modalities of treatment. That's the area of my interest.
So you should come visit our lab and
Yeah.
there are many research projects we can look at.
Yeah, please give me that opportunity. I'll visit.
Is there any favorite movie or like a Rajesh Khanna movie or any other movie that you would like to tell us?
I don't watch much movies. I always see any movie coming with a devotional name, Sri Ramdas or like now Adipurush, whatever some devotional names comes, those devotional movies I attend. But always people tease me with Mere Sapnon Ki Rani song that based on my name. My patients always sing that song for me whenever they come. And a child who is born in my hands and coming to me, growing in front of my eyes, आपके सपनों की रानी है देखो ऐसा. So my name is good for them actually. Yes. I
I,
feel happy.
Thank you so much, Dr. Khanna. It's been such a pleasure talking to you. I think it's great to see that you are doing science and the clinical activities both together. And it's great to see your emphasis on prevention and things that, at least I'm also very passionate about, whether it's nutrition, whether it is, lifestyle and all of that. I think, and that you are very, very aware of genetics and
I'm actually open to anyone who is interested in knowing the basics of the fundamentals of this also. Anyone can just Google my name. Dr. Rajesh Khanna, they can approach me and just they can contact me. Educating wise is always free from side. I can educate. So anyone who is interested, I will be more happy to educate them. Okay.
Thank you so much.
All the
It's
best
been
for
a
you. All the
pleasure.
best. My support for such programs will always be there. We will work together and you come forward, whatever is needed from my end, I'll support you.
Thank you so much. Thanks.
Take it. Bye bye. Yeah.